everyone, and welcome to another episode of Caffeinated Coverage Talk. I am your co-host, Michelle Burnt, and I am the president at InsurTech Hub.
I am Todd Hall, the CEO and the founder of InsurTech Hub.
And we are thrilled to introduce you to the newly appointed CEO of Revive Health, John Lufburrow. Welcome, John.
Well, thank you so much. It's an honor to be here.
Yeah, when we saw that you had been promoted, Todd and I were so ecstatic for you. Like, one, it was a no-brainer. Two, so well-deserved. And three, we're like, hey, we know that guy.
Yeah. Well, thank you. Thank you for that. I appreciate it.
They say it's not what you know, it's who you know. So I'm glad we know you, John. Yeah.
Oh, and right back at you. I'm glad I know the both of you.
Yes, yes. Well, part of the best thing I want to say about the caffeinated coverage talk is the caffeine in the coffee. So do you drink coffee? That's the first thing we need to know about John.
Yes, I have been an avid coffee lover and drinker for as long as I can remember. Somebody asked me, how many cups of coffee do you think you've had over your lifetime? I don't think that's calculable. I do. I love coffee. And the question I know you're going to ask is what kind of coffee?
Yes, tell us.
So I'm an explorer when it comes to food in general. I like trying all sorts of different things. So I will tell you, any good cup of coffee is perfect for me, whether it's at a great diner somewhere across the country or whether it's something I'm making at home. I don't have a particular brand that I'm attached to. A good cup of coffee, and I prefer just to drink it regular, so I don't add anything to it. And I'll have two or three cups throughout the day, but my favorite thing is actually an evening cup of coffee. So an after dinner cup of coffee is probably one of my favorite things. But you do have to build.
Keep you up?
No, you got to build that caffeine tolerance. You got to build it up.
Wow. Todd, what about you?
I had an after dinner coffee last night because I wanted to watch the national championship football game. And I was so tired. I was like, I better drink some coffee to keep me awake for, till 11 or 12 o'clock. But I'm a Dunkin' Donuts kind of guy. Coffee, that's my go-to. So I like Dunkin' Donuts. I used to tease around. I used to put coffee in my cream and sugar, but I've kind of changed that because I'm getting old. So I'm trying to be a little healthier. So I've kind of cut back to, a little bit of cream. I use this Italian sweet cream with zero sugar. So try to, probably about 4 cups a day, on average. I'm constantly, it's a habit for me. So I'm drinking it and it gets cold. So I go to microwave it and finish it. So but probably about 4 cups a day.
Yeah. I need to get you then one of these mugs. So this is an ember mug. Yeah. And so it keeps your coffee warm. It charges every night. And then as you pour a cup, it keeps it warm for much longer than a regular mug. You need to step into the world of ember mugs.
I'll do that. Yeah.
Are those the ones that you can charge them in your car while you're driving down the road too?
Yeah, you can charge them in your car. This is the one I use at home. You can see kind of there's a little red dot there.
Yeah.
Yeah.
And you can adjust the temperature with the app on your phone. It's way overcomplicated, but if you're like me and you'll enjoy a cup of coffee over an hour, you can keep it at that peak temperature that entire time.
Todd, you need that. I know what I'm going to get you for your birthday this year.
I love it. There you go. Well, Michelle, what kind of coffee do you like?
So I try to be healthy, but not when it comes to coffee. I like coffee with my creamer. But I was telling you guys when we hopped on today that supposedly we'll see Dallas may get some snow or ice this weekend. And there is nothing than a cup of coffee in front of a fire.
Yeah, that's the best.
I swear it tastes better. So I like all types of creamers. But in front of the fire this weekend, I'll let you know how it goes.
Love it.
Yes. Well, John, we are excited to hear more about Revive Health. So let's just dive right on in. So tell us more about your background and what brought you to Revive Health. I think I saw 3 years ago. Has it been?
Yeah. So I actually just celebrated my third anniversary here with Revive.
Congratulations.
So I'm in my fourth. Yeah, thanks. I'm in my 4th year. I was originally brought over as the chief revenue officer. And, I was fortunate to know the early founders and the investors in Revive. and had been talking and consulting with them for about 6 months prior to that. But it was just a natural evolution for me. So, 25 years in healthcare. I've worked for big companies like Procter and Gamble and Sanofi. And then I worked for about 6 years for one of the big blue plans. And, it kind of got into a point where I really was interested in making a larger impact, a direct impact on patients, or what we call it, Revive, our members. And really focused on, like, I'm a basic person. So when I look at problems, I think about what are the fundamental elements, right? What are the things that will make the biggest impact if I make a change here or there? And in healthcare, I see the prevailing barriers around access and affordability. And so I knew, as I was transitioning, kind of coming over to Revive over 3 years ago now, I wanted to be in that space. I wanted to make a big impact on Americans. I wanted to help them with the basics, because I think most American families are struggling now in healthcare, even with those basics like access and affordability.
Mm.
If you're impacted by one or the other, it's a tough go, right? If you can't access the system, you're going to be struggling with your health. If you can't afford it, you're going to
Mm-hmm.
be struggling with your health. Some people can access it but can't afford it, right? And if you're impacted by both, well, that's kind of a double whammy. So I was excited about their value prop. I was excited about what they were building. I believed in what they were doing. And I thought it was so basic and so appealing. I knew I could come over and help them to be successful. So, really over the last 3 years, I was operating as the chief revenue officer, helped to scale Revive, from very early days, somewhere around 10 million in revenue, all the way to a run rate of 130 million. And we'll go far beyond, right? And so being a part of that growth was exciting. But being on this side of healthcare and kind of outside of the traditional system, has always been very appealing to me. Plus, I love the entrepreneurial nature of fast growing companies. And so that was, a big part of my attraction here. But yeah, my background is simple. I'm a passionate leader that likes to make a impact in healthcare. I work hard to be an inspirational leader in everything I do, and we pride ourselves at Revive at having a really strong culture, and culture is more important to me than any business metric. And so being a part of that and leading that is a great honor for me, and I'm just so excited about our future.
And we
Love
just
it.
found
Love
out you have 12-year-old twins.
I do.
it.
Yeah,
You
my
are
my wife
busy,
my
man.
my wife and I have a twin, twins, a boy and a girl, and it's absolute greatest blessing of all time.
Oh, I love
Love
that.
it. Love it. John, in the industry now, a big buzzword is virtual care.
Yep.
That's very big, and we hear that. That's a constant, consistent topic that we're hearing in the industry. But what is your opinion? Why do you think that is, and
Mhm.
where do you think that's going to go in the future with virtual care?
Well, if you think about what virtual care is, right? Yes, it's getting care where you don't have to go into a brick and mortar setting, right? But really, it's care in the home, and many times in an on-demand nature. And if you think about all of us, right, in our daily lives, how many things have changed dramatically? If you think about, you could go on to Grubhub or Uber Eats today and have dinner brought home.
Yeah.
Mm-hmm.
You could go on to Amazon or any internet shopping site, right, and buy something that you need and it gets delivered to your home. If you pop on your television, you probably have 4 or 5 streaming services where you can watch a movie instantly. Like our lives have just shifted into this kind of desire to have things that are on demand. And healthcare really shouldn't be any different. So I like to think of virtual care more as just care in the home, right?
Mm-hmm.
And we've been a great pioneer in this regard, because we do some special things to make that a high quality experience for our members. But getting more care at home that's the macro trend. And you're going to see that continue to expand, because it's getting care on your terms versus having to kind of enter the traditional system, which we all know has its perils, right? If you think about, Todd, you and I are similar age. I won't dare to guess how old you are, Michelle, but I know you're younger than we are. Um,
You might be
but
surprised.
She is.
well, but for our whole lives almost, like when you thought about going to see a doctor, right? You knew what that entailed. It was calling them, booking an appointment, doing whatever prep work you had to do prior to that appointment, like filling out your medical history or whatever it was. It was getting to the appointment, maybe taking time off work to do that,
Yes.
sitting there and waiting in the waiting room, filling out more information. And you're, always kind of confused why you fill out that clipboard every time you show up.
Yeah. Sitting
Giving
around
them your
sick people.
right, giving them your insurance card, going back into another room, sitting for a little bit, and then in comes a provider for a hot 6 minutes. And today, unfortunately, they hardly look up at you because they're so busy doing the record keeping that's necessary in their EMR. It's just that traditional experience was ripe for disruption, and one of the easy ways to disrupt it is how do you quickly connect people with a provider, do it on their terms, and allow them to do it in their home. And it's absolutely the appropriate site of care for a lot of the care needs that we're going to have in a given year. And so, Revive's very passionate about making that experience the best it possibly can be. Really, we talk about a world-class experience, and let people experience healthcare differently and make it seamless and efficient and easy. And when we do that, similar to kind of the when rideshare apps were becoming very popular, like if you used, Uber once or twice in the beginning, you were never going back to yellow cab.
Yeah.
You were set for life.
True.
We see that same with our members. When you use Revive once or twice, we have you for life. You're going to try to use us for everything that you possibly can, and we love that, right? Because we're built for that high volume, and so we're really changing the game. As far as I know, we're the leading provider when it comes to kind of high utilization and high volume. And we're so proud of that. And that means, people are basically voting with coming back to us versus going to the traditional system. Now, they oftentimes will have that there if they need it, right? If there's high acuity care needed, that's the appropriate time to pull the insurance card out and use it. But for most of us, we're going to go through a year and we're going to have some very basic things we're going to need help with, and it can be expertly done virtually.
Yeah.
Mm-hmm.
Especially as parents, it's game changer. Like, so you're saying, I mean, think back, like when my kids were little, we didn't have that. But when you are in the comfort of your own home in the middle of the
Yeah,
night with a screaming child, you can
that's right.
call in, speak to an actual doctor, and by breakfast, have, if applicable, your
Yep.
medication called into the nearest pharmacy.
That's exactly right. And there's a lot that has to happen on the back end. It sounds easy, but operationalizing all of that and making sure that it works perfectly, the logistics behind scheduling of our doctors and all those kinds of things. But it works exceptionally well. And so what are we doing for you, that young mom or that person that has been dealing with a cold or an illness or whatever it
Yep.
may be for the last week? We're just helping you get more of your time back, right? We're making
Yes.
things easy. We're allowing you to get on with your life and get healthier. And really, that's our goal, right? We have this very lofty vision that everybody should be able to live life at their best, right? And you hear a lot of talk in the market today about longevity. That's really about, high quality of life for as long as possible. But like the way you get there is by making care easy to access and affordable for everyone to access, and if you can solve those things, you're going to allow people to live their best version of themselves, and that's what we do.
Yeah. Everybody wants
Mm-hmm.
convenience. I have to tell you real quick. So my daughter's in college and then I got one in high school. And she, these kids think they're invincible in college. I'm not sick.
Right?
I mean, they're just like, I don't have finals coming up. I need to pull all-nighters. And she is a huge fan of virtual care because I'll tell you
Yes.
what, she can call in, get what she needs, and she's back in class the next day. So needless to say, our family is huge fans. But
Yeah.
Mm-hmm.
I want to share some really impressive stats I saw. So Revive works with over 3,000 organizations,
Yep.
over 4 million members, and
Yep.
delivers 5 million services annually. So you got to tell us your secret sauce. What set you apart in the industry, and like how are you able to achieve this?
Yeah, I think so. When you build something that is good and it works, and it's designed in a way to work with kind of the employer in this case, right? Um, there's a natural attraction to it. And so it wasn't hard for us to get in market and tell this nice comprehensive story with our value proposition and get people to understand and see that if they can think just a little abstractly about healthcare and health benefits and what maybe they've been offering for years, that they can move up on the adoption curve and can become an innovator, right, or a leading adopter. And it really wasn't hard to do. It's just, you got to have a clean story. You got to find like-minded customers and like-minded brokers that agree and understand and believe in the mission.
Yeah.
But then it kind of sells itself. I mean, it's like anything else we've seen in any market. When you build really, really great solution or a great product or whatever, it'll take off. And then when you add some other things to it, like, a passionate referral channel or brokers that believe, they become kind of these, evangelists of your story. And so you can grow very quickly, which is what we did. But you can't keep that growth if you're not really exceptional in the delivery part, right? So in benefits, we talk about this all the time. A lot of what we do is kind of sell a promise, right? And so if you're a broker out there and you're listening to this, you're talking about different solutions and products and things that you can bring your clients. But you're really kind of selling a promise, like, hey, if you switch to this, it's going to work better. Yeah, it might be a lower rate, but it's going to work better because of these reasons. One of the unique things we can do with Revive, and I love this aspect of it, is we can work with a customer and let them do a test drive for a little bit, right? Get that HR team access to a VIP membership at Revive and let them, experience it themselves before maybe they make the decision for their whole population. But once we kind of get on board and get in play, that delivery and the quality of the care that you can deliver through our programs, that becomes the part that is very sticky, but allows for our growth, right? Because it's hard to grow if you're losing your customers every year. But if you're not losing them, like in our case, we have 98% retention. We just compound growth. In fact, the new numbers for us, we're now at 3,700 commercial clients, 4.5 million members, and just over 5 million services delivered. Those are actual encounters with doctors or mental health counselors or medications filled, right? And so those are real services, not just people popping onto our app and putting their eyeballs on it. It's actual real services. And so we are a high volume care delivery system.
98% persistency?
Retention, yep. Yep, year-over-year retention.
That right there says everything about your company, right there.
Yeah.
That's a wrap.
John, on your website, and actually we had friends that came down to visit us from Atlanta over the weekend, and they're looking at marketing. The EHP, we'll talk about that with Revive Health as consultants to businesses. They're pretty well connected in the B2B market. First thing he did when we were going to dinner on Saturday night is he did Google reviews for Revive Health. And they were blown away how good they were, because he had his phone. I'm driving and we're talking about it. And he pulls it up. He's like, that's impressive. That's impressive. That's impressive. I was like, I agree. Cause I'm a byproduct. I have the service and I've used the urgent care piece a few times. Good. I did an encounter yesterday because I'm on the weight management program. I'm trying to lose some weight. My brother-in-law says I'm not overweight. I'm just too short. So if I was 6 foot, I'd be okay. But it's like,
hey, I've argued that point quite a bit. I had a doctor once that told me we don't have a weight epidemic in this country. We have a height epidemic. And if everyone was a foot taller, our BMIs would be perfect.
I like that, doctor.
But no, it's your reviews and on your website it talks about, I think it says our customers experience 40 to 50% real utilization within the first plan year. Yeah. And that results in hard dollar savings for the employer and employee.
That's right.
High levels of satisfaction. But maybe tell us a little bit about that if you can, how that works.
Yeah. So we deliver a variety of different programs, and there's customization, within the different things that we do, right? So, sometimes we'll have a customer that comes to us and says, hey, we need a lot of help in mental health and access to primary care doctors. So we can put, those solutions together. Maybe some of them say, hey, we're really reeling when it comes to pharmacy spend, and we need a solution to help lower the pharmacy spend. So Revive has the ability to tailor and customize. Most of our customers kind of buy what I call the integrated whole person bundle, which has elements of whole person care. But the very first thing we do from kind of early on in the sales process all the way through implementation is we explain to the customer just how we're going to achieve the utilization, right? So it starts from a careful intake during implementation, implementing the group. We have a very efficient and consistent way that we broadcast to the underlying plan members what they now have at their fingertips, how to use it, with a direct link into getting them activated onto the portal or onto their app. And, like I said, people naturally will start getting in and start using care, and that compounds in a very short period of time. Usually by about 90 days, we can chart the trajectory of the group over the rest of the plan year based off of their early activations and early utilization data. And we will keep pumping messages as needed to build that awareness of the program and to get people kind of in and signed up and registered. And the nice thing is, because it's not a voluntary program, right? It's a program that you're overlaying and putting on a specific population. So you can do a lot of marketing there. And the best HR teams are partners with us in marketing that. But we build that kind of like, that critical path to getting people engaged. But early utilization and getting to that 40 to 50%, that basically means if you're an employer, let's say of 100 employees on the plan, okay, we will have 50, 55, 60 encounters from your plan members with our services. It's not hard for us to do. If you're self-funded, it makes a direct impact. If you're fully funded, it can help to lower that MLR, which is what you want as you go into your renewal year.
Right.
But it's a powerful program because we drive that utilization. But here's the secret sauce in the virtual care world. You as the provider, the solution, in this case Revive, has to be priced appropriately for the utilization you intend to drive. So a lot of people have virtual care elements that are part of their carrier solution, right? Their major medical carrier solution. Every single, Blues, United, Cigna, Humana, Aetna, they all have some virtual care that's kind of bolted on or part of it. But that virtual care company behind that isn't going to drive utilization because they are priced at like 20, 30 cents PEPM. Okay. And those underlying companies know that if they drive utilization, they won't be profitable because they're so underpriced because the carriers are their customer. Revive has always made the employer their prime customer, right? And so we'll price appropriately for the utilization we intend to drive. Now, the nice byproduct of that is every time people get care through Revive, whether it's that 24/7 everyday episodic, on-demand urgent care, or whether it's our virtual direct primary care or mental health, whatever, we are redirecting what would have been a medical claim. Okay. And so we do one very quick drop down question before you encounter a service with us, which is, where would you have gone if you didn't have this? And the drop downs are, would have gone to an ER, would have gone to an urgent care clinic, would have gone to a primary care doctor or specialist, or maybe I would have done nothing.
That's good data.
It's very good data because it allows us to get a blended average of savings to the plan sponsor. And in our case, our book of business blended average savings ranges from $367 to $442, right? And so a lot of that depends on the cost of care in your region, your area, what city you're in, where you are, and then the data that gets reported by the individual member. But we take that blended average of savings. We always use our low end, that 367, and that's what we use to forecast what we expect them to save. So that group, that employer of 100 employees, we're gonna say we will get you 50 calls into our program. That 50 times the 367 is hard dollar plan savings. That's redirection of care from the more expensive traditional fee-for-service venues. So that's a great way for people to save or lower their MLR. And on the other side of it, our pharmacy program, which I know we'll talk a little bit more about the programs, but that generates significant savings because we help to optimize and cut out the middleman markup that exists in the most common prescriptions or medication fills. And that drives down costs on the pharmacy side of it. So we've got a couple of levers that we pull that get you to a hard dollar ROI. And it's part of our value story. But the bigger thing I like to emphasize is there's a whole softer ROI that's just as important. which is when you connect people to care and you do it earlier, you can help to drive increased productivity, presenteeism, reduce absenteeism. You can also help to cut your attrition down. So when people have a richer benefit landscape, right, they're more likely to stay with that employer. And Revive can provide a very rich benefit landscape while at the same time lowering the total cost of care.
Yeah, that's so good. We could do an entire podcast just on prescription costs. Don't get me started. Good
Yeah.
gracious. So we talked a lot about accessibility and affordability, AA, right? Yep. I love, love, love. But what about how easy it is to use? Because healthcare is confusing, and there's nothing that drives me more crazy than you're trying to just utilize your healthcare, and there's so many options you don't even know where to start. One of the things I love about Revive is that you guys simplified it down into 5 pillars.
Yep.
Can you, and all of those pillars are to contain costs. Can you walk us through what those 5 are? Brief explanation.
Yep. So there's the 24/7 virtual, or as I call it, everyday urgent care.
Okay.
That's you wake up, you don't feel great, you can pop on, and within 5 minutes, you're talking to a doctor at Revive. By the way, this is a U.S. trained, board certified, minimum of 10 years clinic experience physician, right? And it's our physician group. So it's not like a big Uber style network and you're getting some random person. Our doctors actually get to know our members. Our members get to know our doctors. So it's a beautiful thing. The next is our virtual direct primary care. That's more for ongoing chronic condition management. So similar to a direct primary care office, we just host it virtually. You go into that program, pick your doctor, you can stay with that doctor, and they will help you with ongoing primary care chronic conditions, right? And so that's more you drive the appointment, you pick it. Typically in 1 to 3 days, you can schedule an appointment and you get help with your blood sugar, your blood pressure, whatever it may be. The third big anchor is mental health.
Ooh,
so
important.
We are an enormous mental health provider. So we have almost 40,000 mental health counselors today. This is a unique network to Revive as well. And these are all master's level clinicians. They are really geared or oriented towards workforce empowerment and a healthier workforce from a mental health standpoint. But they can help treat people with all sorts of clinical and subclinical mental health needs. We also have a really nice application that's attached to that, which has AI coaching. It has engagement, training, workforce empowerment stuff, all really good things for getting the most out of your organization. And then we have our own pharmacy program. So we own 2 very large mail order programs. They deliver at zero cost to members over 1,000 different medications. These are nice. They make up 80% of the most commonly prescribed medications in the U.S. And we do this simply to help get control around pharmacy spend, but actually drive persistency for people, because about 30% of Americans stop taking their maintenance medications, usually related to cost. They can't afford it, so they drop off that metformin, they drop off that atorvastatin, calcium, whatever it may be. But when you can get it for $0 through Revive and you get that 90-day supply at your doorstep, people will stay on their medication. We also have programs now that are coming out that are helping to address specialty medication spend and a whole host of other things that we're innovating on. And then the fifth is our very innovative and first in its class weight health program. So Todd mentioned earlier, he's taking advantage of that. But this is a physician-led, complete mental health or weight health program. So yes, we have medications available and we continue to leverage medications where clinically appropriate. But the real secret sauce is the physician creates a tailored plan with a health coach. The health coach then becomes your partner as you go through that 12-month journey. It's very personalized.
Love it.
And you have a lot of resources to healthier living, better eating, exercising at home. These are all really important because the medication itself, if it's applicable for you in that journey, shouldn't be the centerpiece, right? The centerpiece should be you evolving as a healthier person, and the medication is just helping you get there.
Yeah, that's what we're missing in America right now. Again, another whole podcast on weight loss, Ozempic, semaglutide, trazepatide. But everyone's just out there to lose weight when you're right, John. The point is to live a healthier lifestyle, something that becomes permanent, not that you just get off the shot or the pill or whatever and gain all the weight back. It's all about living a healthy lifestyle.
That's right. Healthier foods, moving more. These are more important than the medication. The medication
Amen.
will give you that kickstart. It'll get you
Right.
the results. It'll get you going. But at some point, you're going to want to come off of that medication, right? We're as
Yes.
humans, we don't need exogenous GLP-1 for the rest of our lives. The manufacturers want you to be on these drugs forever. That's a great business model for them. But the reality of it is, if we can empower you and you can learn more about whole foods and moving more and
Yep.
making healthier choices, you'll be able to keep that weight off. And those are the outcomes employers are looking for.
Mhm. Totally correct, John. John, this is a huge value add for employer groups, for employees. How easy is it for them to sign up for this program?
Well, it's very easy, right? And so one of the first things that we do is we'll work with any employer to do kind of the front end evaluation. The CFO types are always going to want to see that their investment's going to have a return, and we'll support you through that. As a broker, but really, it's just as simple as getting that HR team to believe or see the value.
Mm-hmm.
And then we do direct employer contracts, right? So it's very easy to get a contract in, and we can implement within 2 weeks. We prefer 30 days, but we've done many implementations in a short timeline. And once we get started, the rest of it is plug and play. There isn't really a lot of work for the HR team or for the broker in terms of just kind of running the play, and let us do what we're best at, which is delivering world-class care through these, kind of bundles of integrated whole person care programs.
And can we
Mhm.
say again that if they want to test it first, did I hear you say, John, they can demo it and test it first to make sure it's a good fit for their company?
Absolutely. I mean, we do this all the time. So as groups are thinking about what they want to do, whether it's for their upcoming renewal or whether they want to do it off cycle. By the way, we don't have to go in harmony with all the other benefit changes. Sometimes that's actually the best strategy because you let it stand by itself and people gravitate to
Right.
it because it captures all
Mhm.
the headlines. Um, but yeah, we can get it in play and get a group to have a 30 or 60-day trial run. Let
Heck
the
yeah.
let that HR team or other people kind of get in, talk to the doctors,
Feel it,
have
see it.
have a
Yeah,
mental health counseling appointment, right? Very few
Mhm.
things and benefits can you test drive, before you buy.
that's
Correct.
good.
100%.
So as we start to wrap up, let's bring up EHP really quick, which is known as the
Sure.
employer's choice, because I know you guys are married together. It's such a great partnership. And of course, at InsurTech Hub, you both are big partners of ours. So how do you work with EHP to enhance the member experience?
Yeah, I mean, it starts with the great partnership with the team at EHP. So, we recognized very early on when we started talking to them that they had in our mind really the best approach to SIMRC plans. They're really
Agreed.
exceptional at explaining these programs, administering them, making sure that all of the different parts and pieces come together perfectly. And we really think of ourselves as that kind of health and wellness engine that has to sit in those plans, right? That's essential to kind of that strategy. But we're in very strong partnership with them. Everything that they do, we do together with them. They were very smart in taking a look at all the different things that we do at Revive and really whittling it down to those 5 programs that we just talked about, kind of coming together in a bundle. It has tremendous value for the employer, both obviously on the tax side, but also on that redirection of care and hard dollar plan saving side. And so it comes together perfectly. And the team over there has done such a beautiful job at bringing this to market. We love that people are experiencing Revive, and we love that they're experiencing Revive through EHP's administration of those plans
Yep.
because it's a very, very smart strategy. When I first looked at this in the early days, I looked at this and I said, well, why isn't every employer in the country doing this? Like
Yeah.
this is a no-brainer. And nobody wants to pay more in taxes if they can.
We're
Um,
working we're
and and
working on that,
and
John.
I know.
We are the
Well, and then
solution.
yeah, and then the
I'm
kind of
sorry.
the icing on the cake is the savings you get from expanding benefits.
Hmm. I agree, man. We our partnership, we're very grateful and blessed to be partnered with you with EHP, and we had a really strong 2025, and I'm very excited what we're going to do together in 2026. It's already
Yeah.
started off. Here it is, January 20th, and it's started off fantastic. Yeah, we're super excited. With John, with Revive Health, it's hard to believe it's already 2026.
Yep.
Is there anything new coming to Revive Health, or what's next for Revive Health
Yeah.
possibly?
Well, I mean, there's several things. What I'll highlight is, within some of our programs, We're adding things, really key features, like in weight health, for instance. We've now created a direct contract for the branded GLP-1s to be a part of it. And so that's at a dramatic discount from filling it through, say, a PBM. So both, Wegovy and Zepbound brands are now part of our program. We're also looking at other therapeutics that are not medications, but they're therapeutics that are very innovative and cutting edge that we're adding into the program. So we're opening up choice, and we're continuing to evolve that formulary so that our providers have everything at their disposal.
Okay.
When you look at where we're going with some other products and innovation, one area that we're really focusing on is mental health. We see mental health as the single biggest rising risk in healthcare right now. And if you think about it, it makes perfect sense. For a long time, the traditional system was splitting these things, right? But mental health really is a part of your physical health, as physical health is a part of your mental health. If you are struggling with uncontrolled blood sugar, okay, and that's the root cause of your depression, okay, you have to have a holistic approach. You got to have providers that are integrated, that can understand that from both sides and work with you to a better outcome, right? And so, when we look at mental health and the impact it has on your overall health, we're investing a lot there. We'll be launching this year a premium mental health product that's designed for the most discerning employers, and it's going to have all of the really broad and expansive capabilities that we can deliver, and only really Revive can deliver, packaged together really nicely. So if you're an employer, like a lot of our global law firms and a lot of our kind of most discerning customers, they are pumping a lot of dollars into trying to help their people from a mental health perspective. So we're meeting their and exceeding kind of their expectations from a new product iteration, if you will. And so we're going to keep expanding with mental health. We're also going to keep expanding with our primary care unit as we look to add in some AI triage and some other elements that'll help people kind of get to their solution faster. And so you're going to see a lot of innovation across the Revive platform. And we're not done just with that, right? We have a lot of other areas that we're going to expand to. Like, our goal is to really help those employers, again, create the richest possible benefit landscape while lowering the total cost of care. So everything is in scope that could meet those two things. And by the way, I think I've talked to you about this before, Todd. It's very uncommon to find a solution out there that can do both of those things. A lot of the times when we look at cost and we do things from a cost perspective and benefits, it's abrasive to the underlying plan members, like increasing deductibles or employee contribution, right? Mm-hmm. That'll help you lower cost if you're a plan sponsor, but it's abrasive. Narrowing a network, abrasive, right? We're very interested in expanding benefits so that people feel really great about the employer they're with and that their employer is creating a culture of care. Well, at the same time, are those things able to lower your cost exposure, lower your total cost of care? And so anything that can do those two things is in scope for us here at Revive, and we're excited about it.
Wow.
Love it. Love it.
You're going to have a big year. Holy moly. I love it. Well, we can't thank you enough. We know how busy you are, John, so that you took time to be on our little podcast. We appreciate it. And again, we love our partnership with you, and congratulations on becoming CEO. And if you are an agent listening in and you have thought about diving into that group benefit space, and you already know a ton of employers, whether small or big, whether it's Revive or EHP, contact Todd and I, and we can help you out. So, John, thank you for being on our show today.
Yeah, my pleasure. Thank you.
John, thank you, brother. Appreciate it. Grateful for your partnership and excited what we're going to do together in 2026 and beyond. Amazing.
Cheers.
Same. Cheers.
Awesome. Cheers.
All right, everyone. Tune in next week for a new topic, new guest, new year, new you. Thanks, everyone.